Thank you for staying with us. Good Morning Kenya gets to continue. My name is Vivian Ndegwa, and right about now we have gotten into our health check segment. And today on health check we are looking at matters cancer. We are just trying to have an in-depth conversation and understanding of cancer. What exactly is cancer? What's the prevalence level of cancer in the country as we speak at the moment? And what is the way forward when it comes to winning over cancer? That is what we're talking about today. And joining me for this conversation is Dr. Leopold Methusalah. He is a resident doctor at the Healthcare Global Cancer Centre. Welcome to the program.
Thank you.
It's a pleasure to have you on board just to talk about this condition that is cancer. Let's begin with just having an overall definition of cancer. We say cancer. What exactly is cancer?
So thank you for having me on your program. And by WHO definition, cancer is a group of diseases that are characterized by uncontrolled and unregulated abnormal cell growth. And not just abnormal growth, but also these cells has the ability to invade nearby structures and also to travel and invade distant organs, otherwise known as metastasis. So by definition, that is what cancer is.
That is what cancer is.
So it's a group of diseases. It's not just one condition, but rather a group of diseases.
Okay. What's the main cause, or what are the main risk factors for cancer?
So there are multiple risk factors, and we can actually categorize them as modifiable risk factors and non-modifiable risk factors. Then the non-modifiable risk factors include sex. If you're a woman, that means you're already at risk for breast cancer, for cervical cancer, ovarian cancer. If you're a man, that means you're already at risk of having prostate cancer. Also age. Most cancer occur between 45 and 65 years of age. So that's already a high risk if you are along that age. And the older you go, the more at risk you are. That's also non-modifiable. There are also hereditary risk factors. If you inherit certain genetic defects from your parents, that is something you cannot modify. However, there are modifiable risk factors that include lifestyle, sedentary lifestyle, also diet, the food that people eat, food that is high in fat, in sugar, in salt, a lack of physical exercise, alcohol consumption, cigarette smoking. All those combined are termed as risk factors for getting cancer. Okay,
I understand that. Now let's talk about the prevalence level. How prevalent is cancer as we speak in Kenya today, if you have the numbers?
Okay, so according to Global Can, the 5-year prevalence of cancer in Kenya as of 2022 was around 100,000 cases. We have over 44,000 new cases of cancer each year in Kenya, and the numbers are going up. And we also have around 28,000 deaths every year due to cancer in Kenya. So currently it's the second leading cause of death, hospital-related death in Kenya, second only to pneumonia, and the third is cardiovascular diseases, but cancer is the second leading cause.
That number is really, really high. I mean, 44,000 people every year it's a crazy number. And the fact that you mentioned that it keeps going higher, probably what is making us get to that point where, you know, the number keeps going up and up?
Okay, so it's really multifactorial. One, I would say it's the urbanization. The more modern, the more Western lifestyle that developing countries in Africa are choosing to. For instance, here in Nairobi, we see fast food restaurants. We see people adopting to more sedentary lifestyle, moving around with bolts. No one is walking anymore. No one is doing physical activities anymore. Eating those fast foods, alcohol, the weekend culture, and so forth. But on the other side is the advancement in technology and also access to medical care that has brought up the attention. Now people are a little bit more aware, more people are going to the hospital, more people are getting diagnosed. So the numbers will obviously go higher. So potentially the disease could have been around for the longest time, but there was a taboo around cancer, and most people never wanted to actually go for checkup, for screening. So the awareness, the access to hospitals that can actually help to screen these conditions has brought the numbers up. Yes.
Oh, that's a really, really high number. And to think that 28,000 of, of those get to die of cancer, that's more than half of the diagnosed every year. What is amiss?
So statistics show more than 60% of patients come to treatment facilities when they're already at stage 3 and stage 4 of cancer. So they come with advanced disease. So that trims down the overall survival time for these patients. And in Kenya particularly, the overall time of survival is around 22 months because most patients are discovered at stage 3 and stage 4. So obviously the numbers of death, the prognosis becomes poorer the more advanced the disease is. If people were more aware and more engaged into screening programs, the diseases could have been captured early and the treatment could have been initiated early and overall survival could have been taken a little bit further. But because they come late, so the death toll becomes higher. But also the cost of care. Cancer is quite expensive to treat. It's not just a Kenyan issue, it's a global issue. Cancer as a disease comes with heavy costs. So some patients would exhaust their funds just on the initial diagnostic stages and they won't have enough to undergo treatment. The modern and new treatments that are coming up are also extremely expensive. So patients really struggle to combine both the diagnostic and the treatment cost and to bear it all for the longest run. Yeah. That is the reason. And
I get the importance of the early detection, just as you put it, because the earlier you get it checked, the easier, or maybe say better, it is for you to get to recover quicker. But for most people, you'll hear people saying, what you don't know won't hurt you. Don't go looking for trouble, don't go looking for something you don't have. Maybe if you can speak to such a person who's watching, and there are the people who stand in that line of saying, what you don't know won't hurt you.
Unfortunately for cancer, it's the vice versa. What you don't know will actually kill you. The good thing is, as the Kenyan government through SHA, they have a comprehensive cancer package which enables patients to access multiple diagnostic services across the country. That is one. Secondly, we have in East and Sub-Saharan Africa, we have the best diagnostic tools for cancer. So it can be detected very early on, and that would save you on the cost of treatment, and it will also extend the patient's life, because if you can discover the cancer in the first stage, majority of cancers are treatable by just surgery alone. There's no need to go through chemo and radio if the disease has been detected quite early. So that will also lessen the cost. So if a patient has a lump, a person has unresolving ulcer in their body, and they're comfortable with it because it does not hurt. The moment it hurts, most of the time, is when the disease has progressed to a later stage. So I encourage the community to engage in screening program. We have vast majority of screening programs. We have a lot of cancer awareness programs, to engage in those screening programs, to detect the disease early on, especially for high-risk people who have first-degree relatives who have actually gotten cancer. They should even be more alert and try as much as possible to detect the disease early.
Yeah, and just trying to look at the early warning signs. I know you've mentioned about the lump. Maybe what are some other early warning signs that may be overlooked? Okay,
so fortunately or unfortunately, most cancers have unspecific symptoms. But some of the commonest, we usually call them the B symptoms. And they usually involve unexplained weight loss, okay, more than 10% of your body weight in a short span, okay, night fevers, night sweats. In some cancers, you'll just have loss of appetite, and unexplained loss of appetite. Your body is always tired during the day. When you do regular checkups, nothing pops up. So there will be tiny regular things that people live with and consider them normal. But the weight loss, the night fevers, the night sweats are among the unspecific symptoms that a patient has cancer. And then now you have the very specific ones like the breast lump, the nipple discharge, bleeding from the nipples and so forth.
Yeah, and can one have no symptoms at all? Can it be present without any symptom whatsoever, and for how long can it go without it having any symptoms?
Now, different cancers have different characteristics, and some cancers are really very silent, and especially the brain tumors. Some of them can stay quiet for quite a while until one day you just collapse and they do a scan and they incidentally find them. Early stage cancers, stage 1 cancers, majority of them are symptomatic. They can only be found through screening. So like stage 1 prostate cancer, most of the time it's asymptomatic. The patient doesn't have urinary symptoms, but occasionally when they check their PSA, they would find it elevated, and then they'll do the MRIs and other scans is when they'll actually detect. Same applies even for stomach cancers. Majority of them, when they're in the initial stage, the only thing you'd experience is maybe a little bit of acidity. Most people just say, I usually have H. pylori. That's what they think. And also I have acidity. It's normal. I just take antacids.
Yeah, I think that has been normalized by many people. Yeah.
Yes. That is one of the early signs of esophageal as well as stomach cancers. It will just be acidity frequently, until one day you do an endoscopy, and then that is when you actually detect the cancer.
Oh, wow. So screening is the way to go, because
screening is the way to go.
That's the only way you get to know what maybe you may be ailing from. What makes some cancers more aggressive than the others?
Now, in real sense, each cancer is comprised of different kind of cells that behave differently, and they have evolved differently over the years. It's quite unknown on what exactly drives those cells to be that aggressive, but there are specific cancers that are known to be aggressive. For instance, pancreatic cancers, they are known to be extremely aggressive and extremely silent on the initial stages. So a stage 1, stage 2 pancreatic cancer is usually very silent. You'll only find it incidentally. Maybe you're doing a scan of the abdomen is when you find something weird about the pancreas, or you will just have abnormal sugar control as the early sign, and that's it, of which you'll be treated as a diabetic patient and not as a pancreatic cancer patient. But once it evolves to the latter stages, it is quite aggressive. Hepatobiliary cancers, the cancers around the liver and the gallbladder, are also known to be extremely aggressive. A subtype of brain tumors, they are called CNS grade 4 gliomas, extremely aggressive. We're talking about 6 months of survival without treatment, max. So there are certain tumors, for unknown reasons, they have evolved to become extremely aggressive, and unfortunately, majority of the aggressive tumors are quite silent in the initial stages, unless you actually go look for them. For the longest time, cancer has been deemed a death sentence, you know. Maybe how has treatment gotten to evolve over the years? Because I know so many cancer survivors nowadays, so it's not really a death sentence. So how would you say treatment has evolved over the years? There's been quite a remarkable evolution in treatment, and to start with, it is no longer a death sentence as it used to be before. It is no longer a disease that requires Kenyans to travel abroad. All the modern treatment is actually available here in Kenya, available here in Nairobi. So over the years, we have evolved from, for instance, if we were to speak about radiotherapy, we've evolved over from the 3-dimension radiotherapy, and now currently here in Nairobi, for instance, Cancer Care, HCG CCK is offering SBRT, techniques of radiotherapy. So this is stereotactic body radiotherapy, a form of radiotherapy that enables us to target cancers in very delicate areas. Now we can treat brain tumors without surgery. We can treat cancers in your pancreas without surgery. We can treat cancers in the liver without surgery. And also there's advancement in detection techniques. Now we have PET scans. They're scattered all over Nairobi, We have also evolved in such a way, for instance, I'll give you an example of a cancer or a tumor called neuroendocrine tumors, which are very rare malignancies involving neuroendocrine cells. They are very difficult to detect, and they can only be detected by a very specific PET scan called Dotanok PET scan. So initially in Eastern Sub-Saharan Africa, for the longest run, we never had that scan. Currently, in Kenya, in Nairobi, at Cancer Care, we do have that Dotanok PET. So initially, people had to travel to India just to detect the tumor, not even to treat it, just to detect it. Now it can be detected here in Kenya. So that offers patients opportunity for it to be treated early on.
Yeah.
We have specialized surgeons, we have specialized radiation oncologists, medical oncologists. So it is curable so long as you detect it early, so long as you get access to the right kind of care. Yes.
All right. And, you know, as doctors, how do you get to decide on the specific treatment? You know, there's the radiologies, there's the chemotherapy. How do you determine, does it relate to maybe how far the cancer has gone, or how do you get to decide on the specific treatment? So,
majority of cancers, the treatment is approached in what we call a multidisciplinary approach. Multidisciplinary, it means it's a team approach where we involve surgeons, medical oncologists, radiation oncologists, nutritionists, palliative care specialists. Secondly, it depends on the performance status of the patient, how physically fit the patient is. It also depends on the type of cancer, location of the cancer, stage of the cancer, and other associated comorbidities that the patient may or may not have. So we can take, for instance, if it's a breast cancer that is slightly advanced, let's say stage 3 breast cancer, majority of the time this patient would start with neoadjuvant chemotherapy, whereas the chemotherapy administered before surgery. Then they will go through surgery if they've responded well. Then after surgery, they will go through radiotherapy to consolidate the treatment, to try to damage the cells that have remained behind after the surgery. And then if the patient is hormonal positive, they will go through hormonal therapy. That is the sequence of the treatment. But in some occasions, if it's a stage 4, then they might start upfront with chemotherapy, or they might start upfront with just radiotherapy to try to lessen the burden of the disease, and then go through hormonal therapy to prolong life as much as possible.
Yeah. And when it comes to some cancers, we have the recurring of it. You know, a patient has gone through treatment, gotten to survive it, and then maybe 2 years later, it has recurred. What brings about the recurring?
That's a very good question. And to understand the recurrence of cancer, you have to understand the cancer biology. So when somebody has a lump that is cancerous, it is not comprised of only one type of cell. It's comprised of multiple types of cells that are continuously dividing, creating daughter cells that look totally different from the parent cells. Now, some cells in that cluster respond very well to the initial treatment. So highly proliferative cells, the cells that are highly dividing, they respond very well to radiotherapy, they respond very well to chemotherapy. But some cells lay dormant and quiet. So by the time you're done dealing with the vicious ones, you have taken them out and you have given room for the quiet ones to now grow slowly. So that is how cancer can come about. And that's how it recurs after treatment. So there are some cancers that are notorious for recurrence. There are some cancers that actually respond very well to the initial treatment. But also, it differs from person to person. It also differs from how well or what proper treatment was given initially. If you undertreat it initially, the chances of recurrence are quite high. And unfortunately, patients cannot always afford the full treatment upfront. So there's usually delays in between treatment, which also gives room for the cancer to regrow as the patient is going through treatment at that particular time.
So there's nothing much that can be done?
No, the good news is once you have recurrence, those cells will not respond to the initial treatment. Now we have what we call second-line treatment, third-line treatment, fourth-line treatment, up to fifth-line treatment, and then you have even trials. So now you have chemotherapy, targeted therapy, immunotherapies, and so forth. So the treatment is on and on, depending on how the cells behave at that particular time.
I can only imagine that, you know, when you talk about cancer, it not only affects the body, it also affects one's mental health. So maybe what psychology support are usually given to cancer patients rather, and is it something that is advised, you know, the role of psychology support in all of this?
It's actually, I think, before anything else in a cancer patient, I think counseling is the #1 treatment, because there was a study that was actually done here in Kenya, and they found out more than 60% of the patients did not want to receive prognostic information. That is, they did not want to know what will be the outcome of their treatment. Majority of the patients, the first question they ask is, can I afford this treatment? So that bypasses the role of counseling. They are not interested because their main worry is the financial aspect, but actually the psychological aspect of going through cancer is of extreme importance, because the treatment itself, apart from physical toll, has a lot of mental toll. So the patient has to go through proper counseling channels before, during, and after treatment. For instance, at our facility, we do have a psychological counselor present, and majority of our patients, we encourage them to go through that. But there are also cancer support facilities that offer free counseling, like Faraja Cancer Support, that offers free counseling to cancer patients, and it's also available in our facility. So we even advocate that the patients go through that. They also get to join what we call support groups, where they join other cancer survivors. They join people who are also starting the journey as them, people who are midway, and people who are towards the end, and people who have also experienced the worst. So that creates a unique environment where the patient can actually handle and tolerate the whole entire treatment.
Yeah, so it's really, really crucial in the treatment of it.
Very, very crucial.
Now, as you know, even as we almost come to a conclusion of this conversation, when we talk about cancer, I'm sure you've also mentioned, obviously you've mentioned several times that it's costly, it's expensive, and that is what everyone says, you know. It is really expensive, you know. Maybe who would you say can come on board in just helping with offsetting some of this cancer costs so that it's not as expensive?
That's a very critical part in cancer management, and I personally think the government still has a massive role to play in terms of increasing slightly the packages that is for cancer treatment, also to revise the prices that the government has set, like SHA will contribute for each step of the journey. Some of them may not reflect fully the cost that the patient will undergo, especially considering that private institutes still play a major role in cancer treatment. That is one. Secondly, there is a need for further government and private cooperation, and the government can see ways of subsidizing the costs, either by lowering taxes for the private facilities that offer cancer support, also by lowering the taxes on medication and tools that are used for cancer treatment. By doing so, it will lessen the burden on the private institutes that are actually offering treatment. Then they won't be forced to continue to charge higher if the government is still subsiding on the other part of the treatment. So I think it's more of that, the cooperation between the government and the private sector, to work as a team and not to work as opposite ends, and the government to keep on giving priority. We are actually very proud that SHA has given a very comprehensive package for cancer, but it can always be improved.
Now, I don't want us to finish without asking the question of, is it possible for one to prevent cancer? And maybe what role does your lifestyle have to play in all of this? What role does nutrition play in all of this for those who don't have it, you know, and they would love to stay that way? They would love to ensure that they are keeping up with proper channels, if it's a thing, I know, because sometimes it's inevitable, but just how to go about working on prevention.
Yeah, cancer is preventable, and there are multiple ways to prevent it. And One of them is through vaccines. For instance, cervical cancer, it can be prevented by the HPV vaccines. And there are programs under the immunization authorities of Kenya that children, girls aged 9 to 14, can access these vaccines. Though, as of current, I think only 60% of the targeted age group are actually receiving these vaccines. So the community should try to join hands and access those vaccines. But on the terms of lifestyle changes, to try as much as possible to avoid sedentary lifestyles. You see, with the COVID era, things went worse because now people are working from home. Now people don't even have to brush their teeth to go to work. So you can stay in your bed and complete the whole week in your bed. You don't even have to open the curtains. So to try to avoid that work from home culture at any cost, to at least stay active, to join a running club, to be physically active, but also eating. To reduce the number of times where we have to eat outside, to do our best to have home-prepared meals, nutritious meals. Kenya and East Africa in general is blessed with access to fresh fruits, fresh plants, fresh produce, so people can always access these nutritious foods and do their best to avoid the disease.
Yeah. Okay. What is a misconception, or are there misconceptions around cancer that you would love to demystify?
Okay, first, it's not transmissible. It's a non-communicable disease. So I think there are some families that once a patient has cancer, they're like, they stay away thinking they can contract it. You cannot contract.
The people who still think
there are people, there are some communities who actually still believe it is that.
That's unfortunate.
Yes. The second one is that it is incurable. Cancer is curable, and the survival can be prolonged longer than most people believe. And thirdly, there is no need to travel abroad to treat cancer. The cancer treatment is fully available in Kenya. So I think those are the three biggest ones that people have, that for people still believe maybe Kenya is still backwards. You need to travel to India to access treatment for certain kinds of cancer. All cancers are treatable here in Kenya, and there is no need to travel, and cancer is curable. It's not an incurable disease. It is curable.
Okay. It's very lovely to have that word out there, because it's not a death sentence.
Yes.
It is not a death sentence at all. You can be cured from cancer. I'll allow you to give us your final remarks. That's your camera. Just give us your final remarks.
Thank you for having me, and as a last word, I highly encourage people to engage in screening. I highly encourage people to access information on cancer that is readily available, and I also encourage people to pursue full treatment of cancer here in Kenya.
Thank you so much, Dr. Leopold Methusalah. It was a pleasure having you on the show, just shedding light and allowing us to have an in-depth understanding of cancer. So thank you.